The biggest threat to productivity and employee retention that American business has ever seen is growing, minute by minute, hour by hour. It's a threat that costs business well over $29 billion a year, not including how it affects your health insurance costs. And that cost is growing, minute by minute, hour by hour. The threat is disability, long-term care, and elder care. The growing responsibility of your employees and the aging of their parents. As your employees and their parents age, the problems of elder care begin to appear. Your employees face the problem of dealing with their parents' medical treatment, financial planning for care, and making arrangements for their parents' long-term care needs. Currently, 37% of your employees are more concerned about caring for their parents than their children. And when they face the problem of elder care, your business loses. You lose productivity due to the employee reducing work hours, absenteeism, reluctance to travel or refusal of overtime, not to mention your increased health care costs due to the employee's stress. And when an employee who is worried about how to make or plan care arrangements for their parents is on the job, well, just how much work do they really do? An employee facing these problems has nowhere to go. Their stress level goes up, their work suffers, and your business takes the loss. Not to mention the substantial loss of income and savings the employee loses. The numbers are staggering. 84% of employed caregivers made adjustments to their work schedules, either temporarily or permanently. Work schedule reduction averages 34%. And the problem continues to grow, minute by minute, hour by hour. The percentage of caregiving employees has grown. 60% of working-age adults expect to be providing caregiving assistance for a family member. And even a growing percentage of people in their 20s and 30s are expecting the same situation. Traditional business approaches simply don't work to deal with this problem. EAPs are viewed by most employees as a crisis program for drugs, alcohol, and mental health, not as a source for caregiving solutions. And government or social services are the last resort with delays or dismal results. Your business needs a proactive program to manage absenteeism and employee retention while maintaining productivity and helping your employees to focus on their jobs, not to mention the savings in health costs due to employee stress. The solution? Care Options. This state-of-the-art solution provides the most resources, education, and planning tools available, whether the caregiving problem involves children, parents, or yourself. Care Options provides the answers. Care Options can provide quick answers to a variety of questions. It can provide information in a variety of areas and can help you even create a detailed plan for caregiving. If you want to check on physicians near your parents' home, just give the location, the specialty, and a list of doctors will appear. You can even check their credentials and years in practice. Care Options will even provide a provider locator map for each medical provider. If you're concerned about the costs of care, the answer is just as close. A few mouse clicks and the specific range of care costs is provided, including an easy-to-use estimator. You can even calculate how much insurance or savings you'll need to plan for future care costs. Getting specific information about care providers such as nursing homes, assisted living, and home health care is just as easy. Care Options even provides quality of care inspection reports and other information that lets you make the right decision for your family member. A complete library of information is also available in one location that can provide up-to-date medical information about various chronic medical conditions or diseases. While Care Options can be a source of quick and useful information, its real value is in creating a care plan or an advance directive for health care, a living will. A care plan is a written planning tool for care, such as brief recovery from illness or injury, or for long-term care of a family member. Each care plan consists of assessments, calculation of care costs, locating and evaluating care providers, and information resources. The complete set of assessment tools will help to determine the best type of care, and based on the answers, will include detailed articles and information. A complete financial care plan is created through easy-to-use cost estimators, allowing you to prepare financially well ahead of time for your caregiving role. This plan will include physicians, facilities with complete evaluations, and other specific information. A care plan will even include information and resources for a variety of situations, even including resources for pet care or house sitting, even Meals on Wheels. A completed care plan is a roadmap for care, helping the users to gain basic understanding of the questions, issues, and challenges faced as a family caregiver. It will help to organize and focus efforts to obtain the most appropriate and effective care. And it will save time and money when you work with a professional care planner. The information made available in Care Options is nationwide. It consists of the largest and most up-to-date collection available. Other sites simply serve as gateways to hundreds of other websites, forcing the user to fight their way to find what they need. Care Options is self-contained and complete. The result, your stress is reduced because the answers you need are easily available. Your time is not consumed with worry and concern about your parents or other family members who may be in need of short or long-term care. It also serves as a planning tool for your own planning for the future when you may face the same situation. It is a low-cost and extremely effective human resource tool. It can reduce absenteeism, improve retention, and make a significant impact on your bottom line. Minute by minute, hour by hour, your employees and their parents are aging. For your company, the clock is ticking. Care Options is the solution.